History today in Oregon. The largest ever healthcare worker strike is now underway. Thousands hit the picket lines, and for the first time ever, that includes some doctors. We've also got live interviews with the chief executive of Providence Health and one of Oregon's newest members of Congress and the only doctor in the delegation, Representative Maxine Dexter. Day one of this historic strike is our big story tonight.
Why are we here today?
History made on the picket line Friday morning.
That's right! Why are we here today, guys? Safer patient ratios.
Starting at 6 a.m., 5,000 Providence healthcare workers walked off the job, marking the largest healthcare workers strike in Oregon history. Among their top concerns, higher pay, more staffing, and smaller caseload.
So the reason I'm out here today is because with the current contract that we have, we cannot be competitive and attract nurses to stay at our hospital. Over the past 2 years, we've had terrible staffing.
We are all here. This is ICU. We're usually one nurse to two patients. But sometimes we have really sick patients where some people really need one nurse to that one patient, or even sometimes two nurses to one patient. So they're trying to take away that language from us so that we are just pushed to the bone.
Striking workers include about 70 doctors from one of the state's largest facilities, St. Vincent Medical Center, the first time that's happened in Oregon history, as well as clinic nurses and providers. This impacts 8 Providence hospitals from Portland to Hood River and Seaside, and 6 women's clinics. Those on the picket line have until 9 p.m. Friday to change their minds and return to work.
So we see every single floor, and we've noticed how bad things have gotten.
Bargaining talks between the Oregon Nurses Association and Providence Health executives have stopped, with no timeline for when they'll start again. There's now a cap on the number of patients St. Vincent Hospital is accepting, and many appointments are being rescheduled or postponed. This as nearly 2,000 temporary replacement nurses step in to pick up the slack. Some took longer to get here due to flight delays caused by Los Angeles wildfires.
It has exceeded the workload on the teams that is left, that have no choice but to work. They're asking to take a lot more than they're used to, and it leaves things a little hectic in there.
We caught up with patients leaving St. Vincent's on Friday who tell us what it's like inside the hospital on day one of the strike.
Oh, it's really good right now. The nurses they brought in are doing a wonderful job. The nurse that we had, her name was Denise, and she's from Texas, and she's absolutely wonderful, did a great job.
I've been there for a whole week, and the process just seemed seamless. Everybody knew what they were doing. Everybody was friendly.
It was okay. People wheelchaired me up to the 8th floor, and I met a nurse practitioner. Everything, I guess it was kind of slow.
So yeah, it's great in there. They're still covering all of the floors. The nurses that are working are personable. They're doing the best they can.
Today, Governor Tina Kotek issuing a statement about the strike. We'll put part of it up here for you. Take a look. Governor Kotek says Providence wasted 10 days when they could have been at the table making progress towards a comprehensive resolution of their labor dispute. All hospital staff deserve a fair contract. All parties must return to the table immediately to resolve their disagreements so normal operations and care can resume. Providence responded with a statement of their own, saying those 10 days the governor describes as wasted were actually used to recruit and train around 2,000 temporary replacement nurses. All right, joining us now live is Jennifer Burrows, the chief executive of Providence, Oregon. Jennifer, thanks for coming on the show.
Thanks for having me.
All right, so let's get right to it here. Nurses on the picket line there, they tell me they want higher pay, more paid time off, better staffing ratios. They say how it stands right now, there just aren't enough nurses for patients, and they say it's dangerous. Are those things Providence is willing to change?
So let's kind of break them apart and do some of these items kind of one at a time. Certainly Providence has been working to address these issues with the union for over a year. Some of these tables have been bargaining for almost a year and a half. First of all, around kind of higher pay, we have offered higher pay. We're working to make sure that we've got a market competitive rate. We currently have offers on the table that average about a 20% raise, that's 20, over the next 3 years for acute care RNs, with a double-digit pay increase that comes this first year. You know, a typical acute care nurse that is been in practice for a few years makes of an average of about $125,000 a year. Oregon nurses, we value our nurses in Oregon, and they're among some of the highest paid in the country. We've been talking about how do we make up the gap for the time the contracts have been opened, and so we are offering also a $5,000 bonus upon ratification for nurses whose contracts have expired. For physician contracts, we've also got increases and incentives built into those contracts that are open. Many full-time physicians, represented physicians, the offer that's currently on the table is somewhere between $20,000 and $30,000 a year as an increase. When we talk about time off, our time off is different between different contracts. You know, each team has kind of chosen a little bit of a different blended benefit package. But on average, a new graduate nurse gets 23 days off a year, so that's just shy of 4 weeks. And on average, a 7-year nurse gets 28 days off a year, which is 5.5 weeks of paid time off. Specific to nurse staffing issues, in the 10 years I've been in the state of Oregon, you know, we've talked about nurse staffing a number of times. We've continued to, you know, enhance the legislation around nurse staffing. And in 2023, Providence was one of the partners at the table with ONA and SEIU to pass the most comprehensive hospital staffing law in the country. And that included mandatory nurse to patient ratios. That was a new ad in Oregon. We're 100% committed to following the law. We understand that the nurses want more than the law requires, and so we've been working through that in negotiations, working on strategies to be considering, patient acuity among other variables.
Okay, so as you mentioned there, you know, this has been a lot of talking for a long time now about this. So from your perspective, what are the biggest issues that the two sides can't agree on?
So I think it's you know, these things take conversation, they take time to resolve, and we're working to do that. I think you know, one of the challenges is, you know, we have known for months, ONA has been calling for this historic strike to achieve industrial power, and those are their words, they're not my words. You know, calling to have nurses wait for contracts so that they can align contract dates and have kind of permanent bargaining power. And so I think that this strike is a tactic to achieve both of those ends. We are hopeful as we stabilize operations that we'll be able to get back to the table and both sides will be able to work on compromises so that we reach an agreement.
Are those negotiations scheduled?
They are not yet. We promised as soon as we get our operations stabilized that we will reach out through the federal mediators to get back to the table. Our handoff this morning went well, but we've got a night shift that comes in and takes over care, and so we'll know by morning where we're at in terms of hospital operations, and if we can free the nursing leadership teams up that are currently taking care of departments to get back to the bargaining table.
So I have to ask you though, if you're not negotiating, what is happening on the Providence side, your side, to bring this to an end? How long can people expect this to last?
As I said, you know, our first focus has been on ensuring that we're able to care for the community, that the community does not feel the impact of this strike. And as soon as we're able to pivot and free up our nursing leaders to bargain, we'll be doing that.
So this is the first time this has happened in the 165-year history, and this has been a long time coming, as you mentioned. So why did it have to come to this? Why was this not avoided?
We have worked hard, as I said, to avoid this situation. This is the third strike that we have endured here in the last 2.5 years. I think two things are happening. First is, you know, there's a lot of change in healthcare. And certainly in Oregon, the healthcare systems are having kind of a historic reset. That's not unique to Providence. We're seeing that kind of across the state. We see headlines every week that demonstrate that Oregon's healthcare environment is under stress and will look different. It's certainly, we're going to see differences in physicians and nurse wages and in working conditions related to that.
We've been watching this develop all day, and some of Oregon's elected leaders are taking sides here. The governor calling those 10 days wasted. What do you make of that?
You know, I want to start with the, in our last two strikes, we've followed the same process. We work hard to work to an agreement. The teams worked many hours the week before Christmas. Some teams continued to work through most of Christmas Eve, seeing if we could get ourselves to a place where we could reach an agreement. The parties agreed that we would reconvene after Christmas. That didn't happen, and instead we got a strike notice. From the time we get the strike notice, we've got 10 days to make sure we're ready to care for the community. Those 10 days include recruiting our temporary replacement nurses, getting them onboarded and oriented, and getting them ready to practice. We make sure that we have got those things in place so that day one, we're able to function with a high level of reliability. We take our responsibility to maintain hospital operations very seriously. This is related to patient safety and care of the community, and so we need those 10 days to be ready. Imagine kind of taking 2,000 additional people into a workforce. It takes an immense amount of effort. We're the largest healthcare provider in the state, and we take care of people in very vulnerable positions. And so it's important we do this well in the short period of time we have. There really is no room for error. And so I'm willing to accept the criticism if it means that we're able to do this correctly. My first accountability is to the patients in our care and the communities we care for.
And since we've been hearing from several elected officials today, do you think they have a role to play that would be helpful in reaching a deal?
I think certainly, I spoke with Congresswoman Dexter earlier in the week, and I certainly share her admiration for our healthcare professionals. We both recognize there are a lot of issues currently impacting healthcare, and both locally and nationally, and I'm looking forward to working with her in her new capacity to address the systemic issues that face us.
Okay, Jennifer, thank you so much for your time tonight. I know you've been up early today. We appreciate you joining us. All right, now back out to the picket line. When I was there this morning, Oregon Congresswoman Suzanne Bonamici showed her support for the healthcare workers, and here's what she told me.
It's truly, truly unfortunate. The people I represent here in Northwest Oregon deserve access to good care. And when there's a strike of this magnitude, it's going to affect people. There's no excuse for it. They should never, Providence needs to stay at the table and keep bargaining until they can come up with a way to have safe working conditions for people who work here and fair wages.
Now, she is not the only member of Oregon's congressional delegation weighing in on all of this. Joining us now live is U.S. Representative Maxine Dexter. She is a new member of Congress serving Oregon's 3rd congressional district as a Democrat. She won the seat following the retirement of Earl Blumenauer. She is the only physician in Oregon's delegation, so this strike hits home for her in more ways than one. Representative Dexter, thanks for joining us.
Thank you so much for having me.
So what do you make of this strike, the first of its kind in Oregon's history?
Yeah, the first thing is that it's incredibly unfortunate. The second is that it's fundamentally about patient care and their safety.
And you're a doctor, so when you hear these healthcare workers asking for things like smaller caseloads, I can imagine you know what that's like and where they're coming from.
Yeah, absolutely. This is an issue in every system across our region, and we have a fundamental crisis. We don't have enough healthcare providers to provide the care for increasingly sick patients who are delaying care so that they don't have to pay out-of-pocket costs, so they come in sicker. Sometimes they stay longer, and we can't get patients moved to the level of care that they need because we don't have enough providers throughout the system at all levels.
And this is the first time doctors are striking in Oregon, about 70 of them. I'm curious, when you were practicing, did you ever come close to striking?
No, I had a very different practice environment. We were in a physician-owned group with a lot more professional autonomy, and I think that's foundational. What I've heard from many of the Providence physicians, and certainly from the nurses, is that they can't control their work environment. They don't feel like it's safe. when they need help, they can't get people to come in. And so, these are mission-driven, hardworking people. They want to provide care. They go into these practices because they care about patients. What they are feeling is unsupported, and we really need them to be in a place where they feel professionally that they can practice the care and give the care that they need to for their patients to do well and to thrive.
And as an elected official and physician, do you think elected officials can play a role in helping the two sides reach an agreement?
I think we always play a role if we need to. Foundationally, this is a contractual decision for Providence and the nurses and the doctors and all the health providers involved to be at the table and really negotiate. This is a hard situation, and it's unfortunate with, when elected officials need to get involved. The reason that we will is if we have to is because patients aren't being centered. And that is really what I'm concerned about, is that not being at the table urgently prolongs the time until patients are back at the center of being cared for by the people who belong in those systems.
All right, Representative Dexter, thank you for your time tonight.
Thank you so much.
Okay, so what's going through your mind when it comes to the Providence strike? Did you hear anything tonight that surprised you? Send us your thoughts. Email the story at kgw.com or call and leave a voicemail 503-226-5090.